Hi, my name is Jacob Robinson, and I'm a third-year medical student at Lake Erie College of Osteopathic Medicine. The poster is entitled "The Effect of Exercise on Restless Leg Syndrome Symptom Severity, a Meta-Analysis." I'm here with my classmates who also helped with the research. We have Pritha Patel, and Jenna Mamatov, and Karen Fain.
All right, so our presentation was on restless leg syndrome. It's a pretty common neurological disorder with a prevalence of approximately 10% in the general population. Patients often will experience these uncomfortable sensations, and it can interrupt their daily life. Exercise has been proposed as a non-pharmacological method to decrease RLS symptoms, and previous studies have been done, and we thought it was worthy of conducting a meta-analysis on those studies in order to see whether or not exercise could potentially decrease restless leg syndrome symptoms. In addition, we know that the condition can either be idiopathic or have secondary causes. There are secondary causes like chronic kidney disease, pregnancy, peripheral arterial disease, and also pharmacological treatments for this condition as well. Multiple studies, however, have shown that exercise is an option, such as massages and foot wrapping as well. And this meta-analysis essentially will analyze the effects of consistent exercise routines on the severity of RLS patients suffering from that condition. Our hypothesis was that exercise will decrease the International Restless Leg Syndrome scores in patients diagnosed with this condition.
So the methods for this research project included performing a literature search on the PubMed database. From the search, 6 primary sources with comparable output metrics were used to examine the relationship between exercise and restless leg symptom severity. The data in each study was used to calculate the difference in the mean international restless leg syndrome score for both the treatment group and the control group. This was done using the means from before and after the treatment was applied. The standard deviation change for the difference of the means was calculated using the equation below seen on the poster. Data was inputted into Review Manager 5.4 and was used to calculate the weighted mean difference for each study, as well as the 95% confidence interval. A fixed effect model was used due to a low heterogeneity. The I2 was 0%. The software performed a z-test to determine the statistical significance of the overall effect, and a forest plot was created.
And our results show that the exercise groups had a significantly higher reduction in IRLS scores. The reduction was a reduction of 5.86 compared to the control groups. The Harrison 2018 study using the novel fatigue and stretching exercises displayed the smallest mean difference, while the largest mean difference was in the Gianchi 2013 study. And in this study, the patient cycled in a recumbent cycle ergometer. Our results were statistically significant because the p-value was less than 0.01. We've plotted our data in table 1, and you can see our forest plot in figure 1.
So the overall effect showed a significantly higher reduction in IRLS scores in the groups that did receive some form of exercise treatment. Consistent exercise routines are a viable non-pharmacological treatment option for RLS patients that could be used alone or combined with available pharmacologics. And several of the studies available focus on RLS in hemodialysis patients specifically, which may limit how much our study can be applied to the overall RLS patient population. Studies were done in other RLS patient populations that showed a statistically significant decrease in RLS symptoms, but were not able to be incorporated into the meta-analysis because of a non-comparable metric of measurement. The study also did not control for the type of exercise in which RLS patients were engaged in.
So we found that consistent exercise does improve RLS symptoms, and it decreases IRLS scores in RLS patients. We think that future studies should be performed in a wider set of patient populations instead of mostly just hemodialysis patients. We also think future studies should compare the efficacy of different exercises as well as the intensity and the length of the exercise to find out how to maximize the benefit for these patients. We've included our references in the bottom right-hand corner, and we'd also like to thank Dr. Keller for her help in this project and her support along the way. Thank you so much for listening to this presentation, and we hope you have a great day. Thank you.